Welcome to Talking Allergies, the podcast where we talk all things allergies about all types of allergies in all kinds of allergy lives.
From food allergies to environmental allergies, special guests, community stories, allergy insights, giveaways, and more.
This is your allergy podcast for all things allergies. Hi, Melrick.
Hi, Grace, and welcome to another episode of Talking Allergies. On this episode, we are going to be discussing a topic we've discussed in the past, but it's an important topic that we will continue to discuss, which is mental health and allergies. We are also going to talk a little bit about those comments that people make that can support people with allergies, but also some of those comments that do more harm than good. And we have a special guest on who works in the mental health space with allergies, is an allergy mum, and has allergies herself. A lot on this episode, which is really good to talk about.
It is. Mental health is an aspect of dealing with allergies that is so important because you've got everyday vigilance in your everyday life living with allergies, but then you've also got different mental health aspects that can come up that also need to be discussed, and it's really important to talk about.
Yeah, and at the foremost of this topic with mental health and discussing allergies and the comments around it, it's really important for anybody that meets someone that has allergies. It doesn't have to be someone you know. It could be someone you've met for the first time, to treat them with support and respect, respect their allergies, respect their decisions around their allergies, whether it's them wanting to avoid risks for themselves or a loved one in case they're caring for someone. Respect that they have to monitor and manage their situation the best they can, because allergies have a lot of challenges that you may not be aware of, and people that don't have allergies or don't have the person that they're meeting's allergies, they may not be aware of.
And when we say respect someone's allergies, it means if they say they have an allergy, believe them. Don't second guess it. Don't say, yeah, but what about a little bit? Just go, okay, I get it. Don't try to push the point or say anything around anything else. Just respect that they have those allergies.
Exactly. And going into that supportive comment sort of element. Now, supportive, positive comments can go a long way to helping a person that has allergies. Now, we have brought up some of these comments in previous episodes, comments like, you're not alone, I've got your back, it's all right, thank you for letting me know, I'll keep an eye out for it, and even when you're going out and so going, I can cater for you. Whatever it is, we all speak differently. However we comment and support, that's very important.
It is. Supportive comments make such a big difference, and supportive actions. The other day, Melrick, there was someone that I was going over to a friend's house, and they had said, one of the people had said to the people next to them that were eating cashews, said, Grace is coming over. Quick, you should get in the shower, wash off any of the residue, and also I will clean the kitchen and put the cashews away. They had this conversation without me knowing it all. I came over and they had actually prepared some food that I ate, and I said, thank you so much for catering, I really appreciate it. They said, funnily enough, we actually had a conversation, just a comment before you came over to actually put the cashews away and have a shower. But it was that comment that started the action. And it really stuck with me how lovely that was, that they thought about it and thought to tell someone else to do an action for me. It was really lovely.
Oh, that's so, so lovely. And making sure that we are telling people what we're doing for them as well is really great. So I'm glad they shared that experience and what they did for you, because then you can sort of go to other people maybe even and say, hey, by the way, this is what they did. It was really nice. And it's sort of the passing on that positive message. The more we pass on positivity, the more we can support each other, and then it can expand into other areas of our life too. This positivity and this support doesn't just have to be with allergies. It can expand to any area that we're dealing with. But of course, we are an allergy podcast. So definitely if you meet someone that has allergies, or if you have allergies yourself and it's someone that has allergies too, whichever way it is, support each other, help each other out. Because alongside the positive comments, unfortunately, there are a lot of negative comments that do more harm than good.
making jokes about allergies is not on.
That's definitely a very negative sort of comment that a lot of people make, even if it's just like a on-the-go sort of offhanded comment. But those jokes, and especially ones about death, you just can't do those. You just can't make those jokes. It's not okay.
Because it's such a real threat in people's lives and something that they do deal with day to day, particularly if you have no understanding of it and you don't live with allergies, then you don't understand the way it feels when someone actually makes those jokes. It's more threatening than a joke to the people. And I can say that as someone that gets these jokes regularly at them and lives with life-threatening allergies. It feels like a threat, not a joke. It's really, really harmful.
It is not needed. It's unnecessary. And the trouble with making these jokes is you may think you're making a one-off joke, but you don't realize that sometimes that person that you made that joke about could actually be in a situation very soon after where they are actually at a risk. When you meet a person that has allergies, don't joke about the allergies. Don't joke about their reactions. Stay away from that. Just support them in other ways. Laugh about other things. Smile about other things. But don't make jokes about things where people can die from it.
That pretty much goes across the board, right, Melrick? Like, you don't make jokes about life-threatening issues or things that are threats either. That's not something that's joked about.
People making jokes like that, like over time, it's not needed. And then when it comes to anaphylaxis, I've heard of people make jokes about anaphylaxis symptoms, even asthma symptoms. Like, don't do it. Like, what do you think you're going to get out of this whole situation by making a joke? You're just going to hurt someone.
Jokes are so common and they happen a lot. In my life, I've had a lot of jokes about my allergies. And in fact, one happened yesterday. So I was at the supermarket picking up a block of chocolate that I get every time I go to the supermarket. Yes, I'm addicted to chocolate. So I picked up the chocolate, and one of the people that were in the aisle, so it was a man standing next to me, and he goes, "Oh, that chocolate doesn't taste any good. You should try this chocolate." And I said, no thanks. I have an allergy and I can't actually have that one. And he said, "Oh, nah, you'll be fine. Just try it." And I said, no, I actually have allergies and I'm anaphylactic to it. And he goes, "But you'll be fine with it. What even is your allergy? You will be fine. Just try it." I said, no, thanks. I seriously am anaphylactic. And he goes, "Oh, does that mean it's not really life-threatening to you though?" I said, "Actually, thankfully it hasn't been, but it's come pretty close in the past. As I said, I'm anaphylactic and I've had anaphylactic shock and reactions before. So it's come pretty close actually." And then he says, "Oh, but you're not like this, right?" And then he proceeds to act out anaphylaxis with his hands around his own throat and pretends to collapse in the middle of the aisle. I start looking around the supermarket like, really? I just go, yeah, like that. And then kind of walk off. It was such a random encounter because I don't even know this man. I don't know him at all. I don't know his name. I don't know anything about him. He's a random stranger in a supermarket. And yet he acted out anaphylaxis towards me.
Don't act out someone's reaction, people. And don't do it to random people you just meet in supermarkets. And especially don't persist with trying to constantly tell people what your reactions are. I mean, come on. You're in a supermarket, mate. What are you doing? Like, honestly, like, don't do that, but also don't, and you're talking to a girl, you can't keep on persisting with that sort of commentary. Reverse that commentary. So if you meet someone in a supermarket and they go, "I can't eat that food," and you've got anaphylaxis, be like, "Oh, so sorry. Didn't realize, but I'm sure you'll find a chocolate that works out for you. What do you normally eat? Nice to hear, and good luck with it. See you later. Have a good day." Like, there's other things you can say. You don't have to go down that path.
I'm positive he meant it as a joke, but it didn't come off that way.
I know this is a mental health episode, which is why we're going a little bit further in some of these comments, but we really want to try and help each other with allergies. It's hard to live with allergies and do it alone. We've got to really find ways to make that collective effort to show each other that we can support each other. So you may not have allergies, and we get it. Not everybody has allergies. There are people out there that don't have allergies, but that doesn't mean that you get to go and treat people with allergies differently. They're just like everybody else. They want to do things. They want to eat things. They want to go to places.
They just want to live life.
They just want to live life, right? So when it comes to going and talking to people with allergies, change your tone, change your language. Don't say anything that you think could hurt them, and to support them. It's not too hard, right? If you can't say something nice and supportive, just don't say anything at all.
You don't know their life. You don't know their circumstances. So anything that you do say can be taken negatively or can be taken in the wrong way. And jokes made can do that too and can be harmful. So I agree. Just don't say anything.
There are many people out there that do support, that are positive. And we're not going to forget those people. We are going to highlight those people. And so if you're one of those people that are supporting people out there with allergies, not just saying positive things, but also helping them out. And it doesn't have to be someone that you're looking after. It could just be someone you meet. It could be in a workplace. You could be at school. You could be at uni, on a job site, wherever you are. If you help and support someone with allergies and you say things that make it easier for them to deal through situations, good on you. And thank you.
There's so many people out there that actually advocate for people that have allergies that either don't have them themselves or they'll support other families or other people in the actions that they are asking for. With someone that has allergies or is looking after someone with allergies, it's important to take their word for whether they think that something needs to be catered for or they feel like they can't do something. If they're telling you something and they're confiding in you, then please action it with respect and support. And if they do need that support for mental health, to actually reach out, to actually have them reach out to healthcare professionals. It is such a big aspect of living with allergies that it needs to be spoken about more, which is why we're doing it.
Yes, and the support out there for people that have allergies and mental health related challenges, the support for mental health does exist. We've got a special guest on that is part of that. Allergy Life Australia also do support groups, and there's many wonderful organisations, counsellors, psychologists, mental health professionals that are there to help you and support you. But that support is also extended to the general population. The allergy community is wonderful. They're amazing. Love them all. And the extended community, people that don't have allergies, they're part of that support. Let's just make it easier for everybody. Let's do it together.
Oh, exactly. And Melrick, I actually had an interview with Monique, who is one of the founders of Allergy Support Hub. And Monique is so lovely. She does help with mental health for people that have allergies, which is exactly why I'm bringing it up, but also I had an interview. She lives with allergies herself. She's an allergy mum, but also she is helping people with allergies along with Emma at Allergy Support Hub. But I won't spoil it. She is absolutely lovely and we have a lovely conversation about allergies. Just have to watch.
Yes, Grace Monique is our special guest on this episode. It's a wonderful interview. So let's tune right in and hear all about it from Monique.
Hi, Monique. Welcome to Talking Allergies. Thank you so much for joining us.
Oh, no worries. Thank you for having me. I'm very excited to be here today.
Could you introduce us to what you do?
Yeah, absolutely. So my name is Monique Kerr. I work for Allergy Support Hub. In fact, I started Allergy Support Hub with my colleague Emma. And we provide social and emotional support for families with allergies. So that's anyone from children, their families, adults, across the whole lifespan. And that's our main aim here.
So what's your role in Allergy Support Hub?
I'm what is called the Director of Family Services, which sounds kind of like a big title in some ways, but there's just two of us. So really I run all the family services side of the organisation. So from workshops to what we call hub appointments, which are free one-on-one appointments for anybody who has allergies, who just wants some support. or wants to talk about a particular challenge or issue. And we do a lot of outreach in the community as well. So we go to all sorts of different events and run some play groups. And yeah, I'm responsible for that side of it. But as I said, there's just two of us. So we pretty much do everything between the two of us.
That's fantastic with all the work that you've done and that you've created Allergy Support Hub with Emma.
Yeah, it's been a fantastic journey. We love every moment of it, so it's great.
So Monique, you don't only just run Allergy Support Hub, but you also have allergy experience too, don't you?
Yes, yep. So I grew up with allergies myself. I have a peanut allergy, and later in life I developed a shellfish and quite randomly an eggplant allergy, which is an unusual one. So I've grown up since I was 3, I think. I have known that I've had food allergies. I also come from a family with food allergies, so all of my uncles have food allergies on my mum's side. She doesn't, but she was the only one. So although it was unusual for someone of my age and I didn't know many other people, I did have a family that kind of understood in some ways. And now I have children with allergies, so it's popping down the genetic line there.
How was it growing up with allergies? It
was different back then. I would say there was very little known about allergies when I was young. So it was, my first reaction was I picked up a chip after handling a peanut at a party because, peanuts were at parties back then everywhere. And then ate the chip and had a reaction, swelled up and those sorts of things. And then it was, if you accidentally have some of the food, just head to hospital if you're really feeling bad, but otherwise just have some antihistamine and she'll be right. That's really all we knew of it then. There was a bit of testing that told me that pretty much stay away from all nuts. So when I say peanut allergy, I actually mean I don't eat any nuts. There wasn't really the nuanced testing that there is today or the encouragement to try the other nuts. So I just avoided nuts all the time. It was very unusual. People would sort of ask, "Oh, okay, what does that mean?" Or how come you can't have nuts and those sorts of things. It was definitely a challenge at school. The school canteen, there was a definite lack of understanding. Could you please use a fresh knife and not the peanut butter knife? And there was regularly peanut butter on my little roll that I would order. It just wasn't well understood. So it was a bit complex. Except I was fortunate enough never to have a severe anaphylactic reaction until I was 21 at a party, and I ate some satay chicken. That was pretty systemic reaction, and I headed to hospital with anaphylaxis, and then I got an EpiPen. So then I started to really understand the kind of seriousness. I always knew it was serious, but really understand the kind of serious nature of it and what that meant, and that I really had to avoid them at all costs. And then developed the shellfish allergy. So yeah, it was I would say it was different growing up with allergies back then to how I would perceive it now.
Anaphylaxis at a party is
yeah. Look, I would say probably the most consistent thing I could say about my own allergy management when I was young is that I didn't understand it well and I didn't know how to advocate for myself, which is the biggest thing I've learned as an adult and a mum of children with allergies. So I just, I didn't ask regularly enough. I wasn't cautious enough, and I ate, just grabbed a chicken wing and ate it. And even then I wasn't even sure, should I go to the hospital? We ended up deciding, we'll stop on the hospital our way since it was between my friend's house and our house. And it was quite a serious reaction. So it was good that I did, but it was just that lack of understanding. But yeah, it wasn't ideal.
So happy that you actually made it to the hospital.
Yes, exactly. I know a lot more about allergies now, and I think generally people do, and people are more understanding as well. I think if you're at a party now and someone was experiencing anaphylaxis, people would, even if you didn't think it was time to go to the hospital, people would probably, send you off that way anyway. So I think in general there's a bit more of an understanding.
Definitely. Have you felt that with growing up with your kids with allergies?
Yeah, I think I have. Certainly the nut bans, at schools that came into effect, they sort of, I suppose, raised some awareness for people that it was serious and, that it was harmful to children with allergies. So I think by the time my children had school, there was definitely more of an understanding. I think there's a long way to go in terms of allergy understanding in the community, and allergy awareness, and the kind of behaviours that can keep people with allergies safe. But I would say it's definitely people actually know what allergies are now, whereas when I was young, they didn't even know it was a thing. So it's changed a lot.
How is it different having allergies and having a child with allergies?
Yeah, I mean, as I said before, I think it's actually taught me a lot. It's funny. It is fairly confronting having a child diagnosed with allergies. To see your child, it's one thing to have something happen to you, any kind of health, but to see your child go through that is really confronting and quite hard. And of course, you hope that, and I think everybody who has children hopes that they will be healthy in every way. And anything that upsets that balance is just really challenging as a parent. Having come from an allergy background, I understood allergies. So I think it was a little bit less confronting for me and a little bit easier to assimilate into everyday life because I knew what they were and what it meant and what it looked like to avoid allergens. But it's been a long journey, and I've got a little one with a lot of allergies and quite significant, and he's had quite a lot of allergic reactions. So that was quite confronting. But then I've also learned so much through it, effective use of the EpiPen and using it on time, and how to advocate for somebody as well, and then through that how to advocate for myself. So it's been a learning curve for sure.
You've mentioned advocating quite a lot. How do you advocate for yourself and for your children?
Well, the main thing I think with advocating is that challenge of feeling like you're being demanding. We talk about this a lot here at the Hub. Everybody comes in and says, "Oh, are you sure I can say that? Is that not being too demanding?" And I certainly felt that when I was young. To ask for any accommodation was being demanding or difficult or rocking the boat. And that's a really hard step to get over in advocacy, and learn that, people deserve accommodation and inclusion. And that's, everybody does, with all the challenges that they may have in life. So that's been a big learning curve, building up confidence in that. But advocacy looks like, it can be as simple as, knowing that you deserve inclusion and that it's okay to ask for what you need. And it's okay to reiterate that when somebody is, not understanding or including. And it just essentially means sort of standing up for yourself or somebody else that needs support and help and inclusion, pretty much. But, when it comes to allergies, I feel like advocating is almost every day in lots of different little ways.
Touching on everyday actions, have you seen a quality of life difference between someone that does have allergies and someone that doesn't?
Yeah, look, what we do know, and why we started the Hub, is that everybody deserves to live their best life regardless of, having allergies. Having said that, allergies can have a really big impact on quality of life for a number of different reasons. A lot of the research shows that families living, like children and families and even adults living with allergies, report a lower quality of life than those who don't have allergies, even can be more so than kids with asthma and diabetes. So it can have a really significant impact, and it takes a lot to overcome the challenges and live that full life alongside your diagnosis.
It does. Do you have any tips on how someone could understand the quality of life differences?
Yeah, quality of life differences. I think, as we were talking about every day, it's the everyday nature of allergies. That food is so obviously there's other allergies besides food allergies, but in particular, food is so entrenched in our everyday. It's like who we are as humans. We must eat food to survive. And then having a food allergy almost goes against, being allergic to food and it being harmful for you almost goes against the grain in some ways. And so as a result, it does impact you day to day, and it takes a toll on, it's sort of, where am I going with this? It makes, you've got to make a lot more accommodations. So it takes time to prepare food and cook food. It takes time to set up your house in a way that's allergy friendly. It impacts your social relationships, and family often can have a big impact on family, partners, children going to school can impact their inclusion. So it really, because it's so everyday and because it's so ingrained, and it goes the same as for insect allergies, because obviously that's every day as well, being out and about in the environment. It really does impact every facet of your life. And as a result, without, sort of constant, incredibly hard work to keep it all lovely and balanced, it can really impact that quality of life in many, many different ways.
You touched on people that care for people with allergies. Do you feel like it does affect others in the family as well?
Yeah, absolutely. So what we see the most here, and I think, if you read any research, and certainly what we 100% see anecdotally here, is that it has the most impact on mother as the primary caregiver, usually for most children. It has a very large impact. It changes kind of their life, their view of what they thought feeding a child was going to look like. It can have an impact on siblings because it changes diet and what the family might do in a social way. Depending if, parents have different views on how to manage it, impact that. And then the family as a whole, because the whole family has an idea of what it looks like to be raising children. And that's changed for everybody, whether it's grandparents or nieces and nephews and siblings, your own siblings as a parent. So it can have quite long-reaching effects. In particular, I would say for families who have had no experience of allergies before, because it comes out of nowhere.
Definitely. In one of the previous episodes, we had Emma on talking about allergy anxiety. Have you ever experienced allergy anxiety?
Yeah, I have personally. So when I had that first allergic reaction when I was 21, I had to use the EpiPen, and I sort of started to understand the complexity and nuances, and that it was very serious. But I think at that stage I didn't quite understand the signs and symptoms, and I certainly wasn't confident to use the EpiPen. I still would go to hospital rather than use it. I then had a bit of a spate of allergic reactions. Maybe like 4 or 5 years, I probably had maybe 4 or 5 allergic reactions, like quite regular. Most of them to nuts that I knew, and one to shellfish when I developed that allergy. And that really rocked me. I started to sometimes feel like, even when I was just eating food, that there was no reason there would be nuts in it, that, maybe my lips were tingling, maybe my throat was itchy. What we see here, we call it symptom differentiation, the complexity between anxiety and anaphylaxis. Strong cheeses can sometimes make your mouth a bit itchy, or prosciutto, I find. So there was those sorts of things. And then, I would start to almost go into a bit of a panic about having an anaphylactic reaction. And it took me quite a few years and support to work through that. And at the time, I think I didn't quite realise how much support I needed in that. So it took me a little while to really work through. And then having children with it, it goes through spates of up and down. Different times of their life when they're touching everything. That's a really challenging part. You find yourself kind of every time they're going near things and crawling around, and then as they go to school and you have to hand that control over to somebody else. There's definitely been little spikes in that allergy anxiety since then. But yeah, it was definitely a tough time when I first was confronted by a number of reactions.
You touched on getting support. How would someone find out how to get support for allergy anxiety?
Yeah, absolutely. Well, there's us. So we're Allergy Support Hub. So we provide, the life side, and as we said, as Emma has said in hers, the counselling side of things. There's a number of different ways. So there's a few different, obviously you guys have there's support groups. So it really depends on the type of support somebody would want from, do you want group support? Do you want to meet other people who have allergies as well? If you're experiencing allergy anxiety, like I was describing before, to the extent where it's significantly impacting your life and you're, maybe you're not going out and socializing, maybe you're having panic attacks, very fearful, may even be going to emergency with what you think is anaphylaxis, but is actually panic. If it's having that much of an impact, we would highly recommend seeking psychological support for that, because it's really got into the high level of anxiety, and it can be really hard to manage that yourself, and often you need external support to help with that.
Thank you so much for stepping that through. You spoke about also having an allergy later in life and developing it later in life. How would you suggest someone that is an adult with allergies that has just been diagnosed with allergies or added another allergy go about their day-to-day?
Yeah, look, we see a lot of people with late onset anaphylaxis here at the Hub. I would say it's a large cause of anxiety for people, particularly those who have never had an allergy before. It's very confronting to have an anaphylactic reaction when you just had no idea. So I would definitely say seek help, seek support. develop a support network around you. And in particular, if you're newly diagnosed, making sure that you've got a team of health professionals that can help you understand that and understand what it means to have a reaction and what it looks like. There's quite a bit of online training around the use of EpiPens and the signs and symptoms of anaphylaxis. And then the next step after that would usually be, as an adult being diagnosed, would be educating your family, but also usually with, if you're tends to be, that young cohort in their 20s, educating your friends, because that's who you're out and about with or traveling with, and making sure that they have a really good understanding and are an advocate for you as well. Because sometimes it is hard to advocate for yourself. I find sometimes my friends are better, certainly when I was younger, my friends were better advocates for me than I was at the time, because they're like, we're here, we're responsible for you. Traveled with a friend through South America, and she was, very clear with everybody that I had a nut allergy. She's like, I'm the one that's going to have to manage this if you're unwell. So, and just try and find those people who are supportive of you and who are understanding.
Sounds like you've had a lot of support as well throughout the years with your allergies. Has anyone other than the friend that you took overseas with you supported you in your life with allergies?
Yeah, absolutely. Look, I mean, there's always been people who don't understand. Obviously, if you haven't experienced something yourself, sometimes it can be really hard to understand what that's like. And then other people can, be more naturally, they're just very understanding of lots of different people's situations. So I've had a lot of friends along the way who've been really understanding and supportive. And as I said, will often, if I forget or when I was not confident enough to advocate for myself, would ask for me, which was wonderful. Would make sure that events were, may not have, didn't have nuts in them. And then my husband has been incredibly supportive as well. So we've been together since we were pretty young. So he's kind of, has a really good understanding now. And then obviously that's helped because he's had to raise children with allergies as well. So he's been there for the journey, and his family. So yeah, look, I've been very fortunate in having a family that understood, but it still has its challenges. I've been to family Christmases where there was nuts on the table, which, that you can expect your allergen to be in the environment, but I didn't expect that because we don't often, as in my family, have that. And so then I was like, oh, okay, I have to stop and think, what do I do? I need to tell everybody that it's fine, there's nuts there, but you need to be washing your hands after you eat them. If you're going from nuts to cheese, and it's that we were talking about before, that every day, and that having that advocacy hat on kind of always. But I think, had it been when I was younger, I may have gone, oh, well, I just won't eat rather than have the confrontation. So it's definitely a learning curve. And some people are, are better at than others. And for some it's a learning curve and for some it comes naturally. But yeah, it's that continual advocacy. It's a big one.
It would be a different type of advocacy for yourself as it is for children as well.
Yeah, absolutely. So obviously there's advocating for yourself and then there's advocating for your children. In some ways I would say it's easier to advocate for your children because you're just so that, your core is to protect them. And in some ways you care less what people will think because you're just, I will do what I have to do. But I know, I talk to plenty of people here and they can still find that really challenging. And then the most amazing thing is teaching children as early as you can to advocate for themselves. So really educating them that they have allergies even before they can talk, just having those conversations with them, reading books, making sure that they understand, not that allergies defines them as a person, but that they have allergies and that they need to speak up for themselves, and that they need to be able to say no to things, and to ask for what they need and empower them to feel like they can do that and that it's okay to do that. And I think just speaking matter of fact to them when it's young, doing lots of role play with them, is a wonderful way to get them to learn about their allergies and understand that it's all right. A good thing we talk about a lot here is just talking about differences in general. So everybody's different. We all have our, we all have our similarities. We all have our differences. We all have our challenges. Most people are dealing with something that is a little bit difficult in whatever that looks like for them. So in our family, it's allergies, and we have to adapt our life in this way because that's what we're living with. But, we're not the only ones that are, living with challenges. And that's a great way so that although they may have allergies and may not know anyone else with allergies, but they understand that other people have things that they're having to advocate for as well. And they're not the only one that's, experiencing a bit of a challenge in life.
You have a unique perspective as an organisational psychologist and as an allergy mum and someone that has allergies. Could you tell us why you started Allergy Support Hub?
In a past life, I was an organisational psychologist, so working in corporate organisations. It got quite hard to go back after the birth of my third child because he was, in addition to multiple allergies, he was very unwell. We had to take him down to 4 foods because he was reacting to kind of everything, and he had a lot of respiratory illnesses and was in and out of hospital. So going back to corporate wasn't really an option. So I stayed at home for quite a while. So that was kind of one aspect of it, but the main aspect of it was, as a parent, in that moment, I did feel alone. I did feel, I looked for support and couldn't find it. I just wanted other people to talk to that understood. And I went along to a talk with Emma. I hadn't met her at that stage, although we now know we knew each other at university. But anyway, went along to a talk on allergy anxiety, and it was fantastic. And we just got talking afterwards how we were both so passionate that there was somewhere where people could go, that when you were diagnosed or when your child was diagnosed and you were or when you were in the depths of it, or you'd had a knockback because people weren't understanding, that there was somebody there to talk to who understood what you were going through. And I think as both having a psych background, we were very much like, we can do this. There must be support there. We can provide that support. Emma had already been working as an allergy counsellor, doing it, starting to do a bit of private practice in that space. But we started up as a charity because we wanted to provide as many free and low cost services, because we, both acknowledge the big impact of having allergies on the bottom line and how costly they can be for families. And we wanted to be able to connect with other health services in the hospitals as well. So, but ultimately, it was out of pure need. We both, in our depths of, parenting children with allergies, we just didn't feel like the support was there and felt like there could be more.
Thank you so much for starting the hub and for supporting people with allergies. I know that you do work across Australia as well.
Yeah, we do. So prior to COVID, we did a little bit of work across Australia. As I said, we've got what we call hub appointments, and that's a free one-on-one appointment for anybody. And because that can easily be a phone call, we've always done that nationally. But with the introduction of telehealth more broadly, previously you had to live incredibly remote to have psychologists or any medical telehealth. But now, anybody can access telehealth at any time. So we do actually have quite a lot of clients across Australia. I think, we love it if people can see someone face to face, especially children, but there's not many of us at the moment in this very niche space of working with specifically allergy anxiety. And there is a bit of a nuance to it. And we find that people really enjoy that we have the understanding. We are members of ASCIA, so we keep up to date with, all the latest information on and the best practice on allergy management as well. And I think people appreciate, connect with that. So, people are willing to take telehealth because they're keen for that specialised kind of knowledge.
Definitely. If someone was just diagnosed with an allergy or their child was just diagnosed with an allergy, what is it like for their family?
Your whole world changes overnight. So the difference between, the day before you were diagnosed, whether that's because you had an anaphylactic reaction or a minor reaction or a skin prick test, however your diagnosis looked, whether you're a child or an adult or a parent, your whole life changes overnight. And it's really tough because nobody else sees that. It's a very silent condition. You look perfectly healthy. You are perfectly healthy by all other accounts. But all of a sudden you no longer eat this food. And if you do, it's a life, you're told that it's a life-threatening emergency and you're given medication to manage that. And it's incredibly confronting. And for those families, they have to go home and think, okay, what does this mean now? How do we take this allergen out? What does that look like for our family's diet? And there's often quite an emotional roller coaster that can follow that diagnosis, from parental guilt to grief. It can, and that can go for different periods of time depending on the person, and it takes it takes a little while to get to what we call like the next stage, which is starting to integrate that diagnosis into everyday life. But yeah, I would say, the most significant thing is that it is, your life just changes overnight. I'm not sure how old you were when you were diagnosed, but yeah, it's a big change.
It was. I was in year 5 when I was properly diagnosed. Yeah.
So you would remember that then.
I do remember it quite well.
Yeah. And did you feel that complete change?
Yes, completely.
Yeah.
It completely changed after. So mine was a reaction where I kind of blew up. My face blew up and my throat kind of went numb and scratchy.
Yeah.
And then I got diagnosed with 26 different allergies at the allergist. Yeah.
That's a big change.
Yeah, big change.
Yeah. Huge.
Yeah.
I think one of the, you asked before why we started it, and I probably, didn't put it into perfect words, but what diagnosis is just that first step, isn't it? It's like you're diagnosed, and often we wait for a diagnosis here in Australia as well. You may have a reaction, and to actually wait for the official diagnosis, depending on wait times. I know ours can be quite large here in Western Australia, but it's really just that first step. There's diagnosis, and then there's, okay, now what? Now's the rest of it, integrating it, understanding it, learning about your condition, communicating with others, learning about advocacy. The whole of life comes after that diagnosis.
Allergies is a illness that you can't see, that you were mentioning before. What is your thoughts around that?
Yeah, look, I think that makes it really complex, because I think as anybody, I was going to say as a parent, but also anybody who has just been diagnosed, it's so huge for you. It's as we just said, life-changing, but it's just not visible to anybody else. And I think that's hard with any chronic illness. I think, we sit on a few different chronic illness groups and connect with them. And if you sit and listen to anyone's stories, it's that understanding and validation that people are seeking, because they don't get it from the general community because they look well. And while your world may be crumbling down, it's hard for anybody else to see. And that makes it really complex, especially with something like allergies, which is so pervasive because it is food or insects, it is every day in everything you do. You always have to be carrying your medication, so you always have to be thinking about it. But visibly, you're completely fine, or you look completely fine from the outside. So it does make it quite hard. And I think that's probably where it makes it hard for others to understand as well.
Why is support for people with allergies important?
I think exactly what we were saying before, this idea that you have your diagnosis, and then you have to you're really left to do everything after that yourself. So figuring out how to integrate that into your life, figuring out what your family diet will look like, and how you communicate with your kids, how you communicate with others. You've got to do all of that. And if you have support in that, whether that's external support through someone like us or you guys, or whether that's your friends and your family, having support in that journey, it just helps in every aspect. So I think it's incredibly important. I think it's, certainly those who have support do seem to function, it's easier to integrate, and it's, they have higher quality of life, and just better outcomes, just because, as people, we are social creatures, and to have, people around us and people who understand is really important. And I think specialised allergy support is particularly helpful because it's somebody that understands, whether that's going to a support group with other people on a similar journey to you, or whether that's seeking counselling, or whether, a phone call, or being on a Facebook group that you really resonate with. Any kind of support where you're getting that validation and that understanding from people who are going through a similar experience can just be really helpful.
It can be. Who needs support through their allergy journey?
I would say everyone. Everyone needs support in some way. And as we said, there's a wide look of support. In terms of external support from providers such as ours, it's probably those who aren't getting support in other places, people who particularly those who've not had allergies in their family before, so have no kind of family learning or family understanding of how to integrate this into their life. That can be cultural as well. Sometimes it's hard if some people don't have that understanding, or their families don't have that understanding. And those that are, anybody that's, having any sort of difficulty in life as well, it can, challenging or just doesn't know where to go or what to do. They're probably the, people who need external support the most.
What are the most challenging points of someone's life with allergies?
Yeah, look, I think diagnosis is, step one, for sure. And then it's all the life transitions. So we usually find the diagnosis to about 3 years of age a really challenging time for the families because, little kids are into everything. So it's you as a parent or as a family unit are so responsible for that person's care. And care is complex because they're little people who are, exploring the world in every way, and particularly in their mouths, because that's how they learn. So that can be a really challenging time. And then, every life transition after that. So starting school is often a time where we see families in. Emma would have talked to that there's different ages where children often experience anxiety. So we see families in starting school, starting high school, often some teenagers around, want to be going out more and having more independence, so that independent side, and then adults as well. Often with adults it's newly diagnosed, but we also see adults who've grown up with allergies and just kind of never addressed the challenges that they've had around that, and that sort of, or maybe you've had a reaction. So that would be the other time, is post-reaction. We see a lot of families and adults and children post-reaction where they're really, everything's come crashing down again, and, it's disappointing, and there might be trust challenges. That's a key time for support as well.
You touched on severe reactions. Is it normal to feel allergy anxiety or a level of PTSD around allergic reactions?
Yeah, absolutely. It's very common and normal to experience allergy anxiety following a reaction. Emma may have touched on it, but a moderate amount of anxiety is quite important in being vigilant and keeping yourself safe from allergies. It's almost like it's an adaptive level. Then it can spike into high, which might look like, over-checking things, not going out to social events, panic, all those things I touched on before. I would say probably in the 2 to 3 months following a reaction, that would be a really normal response. Now, that's not to say that you shouldn't seek help in that time. The earlier you seek help, the faster you can get on top of it. But also acknowledging that it is quite a normal process in those couple of months following a reaction. If it continues on after that, that's when you start to go, okay, I think this is a bit more systemic. I think we really need to, probably get in touch with someone and find somebody to support us through that anxiety and hopefully get on top of it. What was the other one? Fear about a reaction.
Yes.
Yeah, look, I think it is, as humans, it's very normal and natural to feel anxious about things that threaten us. And an allergic reaction and having a reaction and eating an allergen is a threat. So I do think people really feel a lot of, not everybody, there's, obviously different people, but they're, people do often experience a bit to a lot of anxiety around having a reaction. And there's kind of a lot of reasons for that, from, fear of using the medication, or, not knowing when to use the medication, or, knowing if you know the right symptoms or what situation you'll be in when you have a reaction. I think there's just lots of things who will be around to help you, and those sorts of things. So, yeah, I think certainly, we see a specific sample of people here at the Hub for our family services. We see a wide range of families, but then obviously we see a lot of people who are experiencing anxiety, but it is fairly common.
When would someone know when it goes from the common to the I should get help stage?
Yeah, absolutely. I think pretty much if you find that it's impacting your everyday life significantly. That's the easiest indicator, because for different people have different levels of tolerance for that. So if you feel that it's impacting your life and you're not doing the things that you want to be doing, and you're not enjoying your life in the way that you want to, or you're not sleeping, those sorts of things, if it's impeding your life significantly, that's when we would suggest to get help and support. That's the easiest indicator. There's others, like, for example, if you find yourself really obsessively washing your hands, or checking packets, or unable to eat out where you were previously able to eat out, or not eating foods that you were previously eating perfectly safely. So any restrictions like that, not engaging in social activities, sleep, or any of those anxiety, physical feelings like racing heart, panic, shaking, trembling, nausea. If they're happening really often, that's when we would suggest it. But the easiest indicator is if you're just not feeling comfortable with it and it's impacting your everyday life, that's usually the time that it's a good time to seek help over a period of time. In the course of a day, if that happens, that's probably okay. But if that's happening, over the course of a month, 2 months, more, that's when it's time to seek some help. And also that help, like knowing as well that help is there, that you deserve help, and help is there. And that might be reaching out to a family member or a friend first, or it might be reaching out to, somebody external, whatever that help looks like for you.
It's fantastic to hear that people have help and that it's okay to reach out and when to reach out, because understanding what is normal and then what is not is impeding on quality of life.
Yeah.
Yeah.
Because I think it's hard, isn't it? Because if you're quite introverted and you don't tend to, go out heaps, and you're quite happy with that and you love being at home reading a book, then it might not be that odd, strange for you personally to be spending a lot of time at home. But if you are somebody who was previously out every second night and, just loves being around people and gets a lot of their energy from being around people, and you find yourself not doing that, then for you, that's very different to normal than it may be for somebody else. So that's why it's so, in some ways, the restrictive behaviours are quite general to everybody, but some of the, the social behaviours and the quality of life impacts are very different for different people.
Especially if it goes down over a long period of time.
Absolutely. And sometimes you may have been living with allergy anxiety without even knowing it, that, you feel like that's a normal and appropriate response to having allergies. And that's fair. It's really hard, and you do have to keep yourself safe. And that tightrope, that balance between moderate anxiety, anxiety and vigilance is keeping you safe and effective, and it being too high is, can be very fine. So it could be years that you may go trucking along, not realizing that actually perhaps this is impacting your quality of life, and maybe you are restricting more than you need to. So it can be hard to notice, and it can be hard to manage.
It can be. Has there been a moment or milestone that you've been proud of the work that you've been doing?
The thing that sticks out the most is maybe a week after we got our first little office. We're at Lotteries West. Again, Lotteries in Western Australia gives out a lot of money to charities. In a nice little Lotteries house that has a great, support for charities. We just set up and we just opened our office, and a family walked in, and they were just in crisis. Their son wasn't attending to school. He'd been to hospital multiple times with what he thought was anaphylaxis, but the hospital suspected panic. This particular morning, he actually refused to go to school at all. He was really struggling, and just the relief on their face, the tears, everybody that walks in almost, I think we have a big box of tissues on our coffee table, and it's just that relief of finding somebody that understands and finding somebody who's going to help you get through this, and not just go, it'll be okay, but actually, okay, what can we do to support you? Even though it was only a week in, I think it still sticks in both of our minds as just, this is why we are doing this. And to be honest, every time I speak with a family and have a hub appointment, it's just such a humbling experience. When they've got so much out of it at the end. So yeah, I would put that up there as for me personally, the biggest milestone that we've had.
That's so lovely. It's so hard to understand severe anxiety and anaphylactic symptoms. So hearing that they were going to the hospital and being diagnosed with allergy anxiety instead is really interesting to hear.
Yeah, and understanding that does happen, that you can have allergy anxiety and that it can be helped. So often it's within, only a couple of sessions through the graded exposure work that Emma does and the CBT, you see improvements in 2 to 3 sessions. Kids willing to go to school, eating foods that they weren't previously eating, and then by 6 sessions it can have a really huge impact. So to see, them go through a couple of sessions and be back at school and be, still a lot to work through, but able to function after just a couple of sessions is wonderful to see, because it is, it can be quite short intervention, because usually the anxiety when it comes to allergies is very allergy focused. Some of the research you look at will say people with allergies don't actually have much more anxiety than the general population, but when you break it down into specific anxiety related to the allergies, then it's incredibly high. Like, it looks a lot higher. So it's a bit more complex than just having anxiety. It's very allergy specific.
If you met someone at the beginning of allergy journey, what would you say to them?
What would I say? I would say don't do it alone. Find support. Often you can be so in that emotional roller coaster at the start that, it just takes you a long time to find that support, or you feel like you need to do it all yourself and it's your condition, so you need to figure it out, or your child's. But doing things alone is the hardest way to do it, whether it's family, whether it's friends, put the feelers out, have chats with people and figure out who are going to be those supportive friends. And if you don't have friends or family, reaching out to, the wonderful different charities and organisations around Australia who are, there for people with allergies, and reaching out and making connection through there and support groups, because the hardest thing to do is to feel like you're doing it alone. And then probably step 2 would be getting a good team of health workers around you as well that are supportive and that are supporting you on your journey.
That's fantastic advice. Thank you so much, Monique. Where can we find more information about Allergy Support Hub?
Yeah, sure. We've got a website, allergysupporthub.com.au, and all our details are on there. You can find us on Facebook and Instagram as well. We're a little bit slow on that. Marketing are not our key skills, but we're getting there. But yeah, you can find us online. Our number's there. The main thing I would say is please just feel free to give us a call. We're here, to talk with you. We're here to chat. Just don't hesitate to get in touch. And if we can't help, we'll always put you in the direction of somebody who can.
Thank you so much, Monique, for joining us today and for talking about your allergy story, a little bit about quality of life and allergies.
Thank you. Thank you for having me, and thank you for the wonderful work you guys do as well.
Thanks, Monique.
Thank you, Monique. That was amazing. It was such a good interview to tune into. I learned so much about that quality of life and how people can approach different situations, and so much to hear about your own sort of experience as well, with not just being an allergy mum, but having allergies yourself. And, it does show you such a different point of view by being able to see that experience through different aspects of life. Thank you. Thank you for joining us on the podcast.
Monique is so lovely, both as a person, but also the fact that she's got so many areas of understanding about allergies, which is the mental health side of supporting people, being an allergy mum and having allergies herself from a young age, and then having new allergies as an adult. She has so many experiences and knowledge in this area. I think her and Emma from Allergy Support Hub are absolutely lovely, and definitely reach out if you're needing their support.
Allergy Support Hub, if you wanted to find out more, is allergysupporthub.com.au. But of course, we'll drop all those deets wherever you catch your podcast. And that brings us to the end of another Talking Allergies.
Thank you for talking allergies and mental health.
Thank you, Grace, and we'll catch you on the next episode on Talking Allergies.
On Talking Allergies.
The discussions on Talking Allergies are here to support you or your loved one on your journey with allergies. The topics discussed here are not intended as medical instruction or as a substitute for advice by a qualified healthcare provider.